Dr. Jeff Harp from Highland Family Medicine is back with us. Doctor, good morning.
Good morning.
Well, we see on the graphic I built COVID cases rising, not just across the country, but here locally in Monroe County as well. Should we be concerned?
Yes, we should. Our rate in Monroe County reached above 2% late last week and doesn't look like it's going to slow down. Our curve is starting to accelerate instead of slow down as it was before. We're not really sure why this is happening, but we have a sense that perhaps this thing called pandemic fatigue is contributing to the problem.
This is something that we have talked about a little bit already. How does it impact people?
First of all, pandemic fatigue is something like post-traumatic stress disorder. If you think about post-traumatic stress disorder, people have a stress, it affects their lives, and they're sort of looking back at it and reliving it. Pandemic fatigue essentially involves being in the stress constantly, so it's post-traumatic stress disorder without the stress ever ending. So how does that affect people? A lot of times sleep disturbance, either sleeping too much or not getting enough sleep, depression, anxiety, irritability, difficulty making choices, low energy, all sorts of disturbances of mood and behavior.
What can we do to cope with these feelings that we're having?
One is at first to change one's habits. Many times people change or begin doing things that are relatively unhelpful, have negative consequences when they're stressed. So stop drinking, stop overspending, stop those things which are going to lead to more problems and replace them with some healthy habits. If sleep's disrupted, work really diligently on getting enough sleep, make a standard sleep time, standard meal times, eat healthy, keep ourselves fit as much as we can. It provides some predictability at a time when much is very unpredictable.
What about our mindset? That's important too, right?
That is right. The way that we look at events that are happening from minute to minute can be very important. Instead of saying, this is terrible, I can't stand this, why do I have to wear this mask again? We can start to think about, well, what am I doing that's different and that's good? I'm protecting my family, I'm protecting the rest of the people around me by wearing this mask. Personally, I've learned to use technology in a way I never knew how to do that before, and I'm learning a lot of new skills. So we can think about how the pandemic has actually allowed us to grow, even though it's really a terrible thing in the background. Maybe even start a gratitude journal, write down things that we really are grateful for. And then we can find ways to take care of ourselves. We can schedule time for exercise, time for quietness. We can give ourselves some time to grieve and say, you know, I really miss doing this or that, but not to dwell on it, to say, well, then what can I do instead that would replace that activity and have the same kind of meaning and feeling that activity that I can't do had. And then we can use our friends and our family, of course, properly distanced, to support us. We can turn to people and maybe be able to have contact in ways we didn't have contact before to really provide us with support.
And doctor, you say if we're still struggling at that point, schedule an appointment with your primary care physician. Our time is short. Let's leave it there. Doctor, thank you.